Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, welcome. Super excited to have you here because we are bringing some really exciting conversations with some fantastic leaders that are painstakingly reshaping the future of health. And we're passionate about a few different key areas here. We're passionate about healthcare innovation, about access, about leadership, and the adoption of that innovation. And if it's your first time tuning in, let me just take a quick step back and tell you a little bit more about what we're trying to get done here. So, the focus of the show is bringing real stories of innovation to life, not just things that you read, not just things that you are theorizing, but people that are actually really getting stuff done within our space and giving them the opportunity to share their stories, share their learnings, and to share their little wins with our community. And if you haven't had an opportunity to check out any of our historical interviews, wherever you are now, whether you're watching this or listening to this, ideally binge watching this, and please hit the subscribe button now so any of these new interviews come directly to you. So today's guests, it's actually pretty special because I connected with them right away. The first time that I chatted with Jacob and Jerry, there was actually a very easy rhythm to the conversation. You know, kind of the moments when you think about, like, yeah, I like these guys. I really like them. And at some point in my mind, I was like, they're definitely going to come on the show. When you know, you know. And Jacob Little and Jerry DiMaso are the co-founders of Payerset. And they kind of have a way of simplifying things. And anyone who has dealt with payer rates knows just how messy that world is. Files don't match, claims don't line up. Everybody's using different numbers and they're hoping that they're close enough. But Payerset is doing something that, in my mind, is brilliant. It's simple. It's very simple to describe, but it's actually really hard to pull off. They take every machine readable file from payers across the country, they tie it back to actual claims and give health systems and medical practices a real view of what's being paid. The truth in one place in a very real way that you can actually use. And here's sort of what I appreciate, what I've taken so far from Jacob and Jerry and the rest of the team is they're not like, hey, let's just build another dashboard kind of people. They're more, let's roll our sleeves up. Let's actually try to fundamentally shape the question, shape the problem, and give our customers something that they actually use. And I'm going to use the L word here, that they love. Like there's a very big difference in that. And so they're helping teams walk into some of these contract negotiations with payers with data and information that changes the tone of the room. They're showing leaders where money's being left on the table, and they're giving the organizations the ability to make decisions with confidence and without having to rely on guesswork. So under their leadership, Payerset is honestly quietly becoming one of the powerhouses in the space, quietly, because people are relying on them and they are making them, quote unquote, making them love them. So today we're going to talk about where Payerset came from, what Jacob and Jerry are seeing across the country, why contract clarity has become such a big lever for health systems that are actually trying to protect their margin. And maybe we'll even just get into some of the mindset behind all of this, including how they kind of stay composed when things get a little hectic. And if you've been in a startup growth company, things sometimes get a little chaotic. So, Jacob, Jerry, what's up? Welcome to the show.
Thank you
Thank
so
you.
much.
What an amazing introduction. Holy
It's
cow.
being it's being recorded. You know, we're known to hype people up. We're trying to give your
That's
best stuff
fair.
here.
I love
So
it.
let's start back. Like guys, we clicked right when we first met, and I
Yeah.
think there's a sort of an ease to the conversation. For people that are meeting you for the first time, like who were you before Payerset? You know, what shaped the way that you see the world? And I'll start with Jacob, and then maybe Jerry chimes in after.
Sure. Thanks so much again for having us and for that awesome intro. I've always been a technology nerd. I've always been a data nerd. Um, I've always had a real passion for people and helping people. I did not get excited about technology or data with my first stint in the corporate world, which was in banking, helping with SOX compliance. So, uh, but got very excited when I switched uh, switched industries and began my work at a children's hospital, Children's
Mm,
Healthcare of Atlanta, and that's when you saw data in a very different way, and I got to sit side by side with clinicians and look at, hey, why in the world is rhinovirus spiking early, right? And these
mm,
kinds of things, as you were, it also was very jarring seeing the data that you see, thinking about children and some of the things that are happening and how sick they are. But this is when I got very passionate around um, healthcare from the care delivery perspective, and from that started a healthcare practice, a healthcare consulting practice, built a network of uh, care delivery organizations across the country, among other kind of organizations in more of the life sciences space, and just really trying to understand like how does healthcare actually work, which
right.
was a rabbit hole to say the least. So that's how I got started.
Right on. Jerry?
Yes, yeah, and I've always been into technology. I went to Stevens Tech, majored in biomedical engineering, so I was always kind of like knew I wanted to do something with healthcare, but also something with engineering and technology. Ended up working at a data and analytics consulting company, built a bunch of different products. Started another business called NAR. I don't know if you can see it's blurred back here, but it's, that was our logo. So that was a business intelligence tool using some of the technology that was built by Click, eventually got acquired by Click. So I've always been into building companies, building technology. This was a really, really interesting challenge because the data was so huge and unruly, and it was everywhere, and it was, it's many terabytes and terabytes and terabytes of data. So the engineering challenge alone was just something that I was really
Yeah.
looking forward to sinking my teeth into, and then kind of learning about how the regulations happened and why the transparency rules in the first place existed, and learning about how contracts are created and how they were like secret sauce for the providers as well as the carriers, and they didn't want anybody else to kind of know about the pricing, which
Wait.
understandable now that we learned about some of
So
it.
when,
But
so do you remember the first time that you looked at the payer data, rate
I
data, and
I
you were like,
yes.
wait, this can't be the system that we're relying on.
Oh,
Where
yeah,
did that realization hit you?
absolutely. Yeah, it was actually Jacob gave me a call. He learned about this problem through his network, and uh, I started taking a look at some of the data and just kind of looking at um, even the tables of contents files. We started with Elevance, one of the
Yeah.
uh, bigger payers, and I spent a lot of time just trying to like dissect their table of contents file. And I was able to parse it finally, figured that out, and then I realized that that's not even the actual data. That's just like a list of file links to all the actual real data, and it's like 20 gigabytes, just the list of links. So right away, I was like, okay, this is more complicated than I expected it to be. Seeing the hundreds of thousands of different types of plans and then all across the different blues, and then finally was able to start parsing the actual data. And then looking at the comparables, and especially with our early customers, they'd be like, hey, is this right? Like one hospital gets reimbursed like $18,000 for a knee surgery, and one gets reimbursed like $1,500. Like that can't be right. It's like, no, it's yes, right. It's just what they negotiated at what time. So who was in charge of the negotiation over compounded over decades and decades and decades of negotiations. Sometimes
It's like
people care more.
who was in
Who
charge of
was in
negotiation
charge?
because they're probably not there anymore.
They're not, yeah, who was in charge, but it's
Right.
been so many years. And then it's like whoever's, a lot of it is around corporate strategy. Like, hey, we're going to try and, acquire a bunch of imaging centers. So we're going to try and increase our reimbursement around imaging. But for, 5, 6 years, that leaves the other rates kind of stagnant because we're not going to try and negotiate them higher. We're really focusing on something else. And just over time, especially when you have thousands of different negotiations going on, um, just you get this kind of really wacky, spiky pricing for every service because it's not really based in cost. It's like loosely based in cost. It's really mostly
Mm.
based in just who was a better negotiator and what did they care about at the time
And market power.
and what market
Yeah.
power.
So let's frame this up, Jacob. Frame this up in terms of price transparency for those that are really not familiar with this and the legislation. Like, tell us more about that and why that actually matters now, and where and what providers are doing maybe beforehand, and how they can leverage this now.
Sure. It's been a journey, but in 2022, mid 2022, there was a ruling called the Transparency and Coverage Rule that enforced the commercial plans. This is just affects the commercial health plans to post every single negotiated reimbursement rate that they have with every uh, care delivery organization and clinician in the entire country. So this is one of the largest, if not the largest, data sets, definitely the largest public data set in healthcare that's ever been published. And as you can imagine, there was a lot of gnashing of teeth, there was a lot of pushback, and there was really low compliance for a long time. If you were looking to get value out of this data in 2022 or even in 2023, it was definitely hit or miss,
Mm.
even with the large insurance companies not being compliant. And I wouldn't say really, it really late 2023, kind of 2024, you started seeing those improvements. The data got cleaner, the data got accurate. And now, I mean, now we're in a world where a lot of our customers are hospitals, but we help all kinds of organizations that need to understand this data. You know, they can match to the penny with their contracts, which is really, really exciting for them and really empowering, but it definitely did not start this way. And it's been a journey of uh, additional executive orders, additional laws. There were like three executive orders, two or three just this year. Um, Really for these large
Mhm.
institutions who have insane power and
Mhm.
huge, publicly traded organizations needing to show quarter over quarter growth, really letting them know, hey, this is here to stay. This is serious,
Mhm.
and we're going to enforce it. Um, and so now we're in this world where um, it's our mission to democratize healthcare pricing. And in doing that, it's really about number one, letting people know it's there, it's available,
Yeah.
um, and that it's accessible, and you don't need to spend millions of dollars trying to get it, which goes into another kind of challenge back in the day with this data, with still today, there's organizations like us that are trying to solve for this, but um, it's kind of when you lose a bet and you pay with a truck full of pennies, right? This is kind of metaphorically speaking, the insurance companies having to post this. Obviously, they didn't want to, so they do it in a way where you would have to spend many, many hundreds of thousands of dollars in infrastructure, hundreds of thousands of dollars more in people and R&D and teams,
Mhm.
and a
Mhm.
lot of time to be able to actually get it, make sense of it, and put it into a format that's usable for analysis and for negotiation, market expansion, strategy, those kinds of things.
So was there ever a time, maybe even early on, maybe even now, where you thought, man, like, what did we just sign up for? Um,
I'll let Jerry answer that first.
take us into that room, Jerry.
Yeah, so every day, every morning, I think, no. No, it is interesting, and we're very fortunate to be able to work with a lot of different types of companies, and we get to kind of see the different stages of development that we've kind of
Yeah.
gone through over the years. So we'll meet people who are like on step five. We're on step 500 because this is all we do all day
Right.
is just
Right.
think about how to make this more efficient, more cost effective, things like that. Um, but it's really interesting to be able to kind of see that and like thinking back on it. I think I told Jacob this the other day is like if I knew everything I know now then I probably would have said it's not possible for us to do this. Like we'll never get to this point. But honestly, it's just a matter of keeping our head down and just continuing to work with people who are actually getting
Mhm.
value out of this data,
Hmm.
like significant value, especially for their hospitals. They're trying to expand, they're trying to help more people. Um, and they're just honestly looking to try to understand what the pricing is
Right.
and what it's supposed to be. And
Right.
that kind of keeps us going. I think it's, having these really great customer relationships. Um, it's not really a matter of effort. It's just a matter of like, are we going to keep going on this mission? And I think it's a worthwhile mission.
Yeah.
We seem to be called to do it. So
Yeah.
So I'm just sort of curious, like what actually happens in the room, like when a health system finally sees their rates inside of Payerset, like like the true picture. Like what
Hmm.
happens in the room? Like what
Usually,
what
usually
what
somebody
changes?
yells, usually somebody yells out loud, "I knew it." Because,
it
a
does.
lot a lot of this is people have a feeling, people know that they're kind of not getting a fair shake, but unless you can prove it, you know, it's just this bad feeling you have in the pit of your stomach. But when you validate your own contracted rates to the penny, and then you start looking out in the market and seeing who's got these really special deals, um, then you're just like, oh wow, this is much the gap is much larger than I even imagined.
Hmm.
So it is kind of there's that strong confirmation. There's a lot of excitement. Then there is a okay, now I know how we can sharpen our strategy. There's this invigoration that happens. Not because you go and it's not necessarily a race to the top where you say like, look, I can see you're giving name largest health system in the country this rate. We want that rate. But being able to talk about the quality of care that you provide, the value to the community, how you're taking care of the community, how you're expanding, why you're important, and why it justifies increases. I mean, some of these organizations haven't had a negotiation or renegotiation or increase in 7 years, 10 years. I mean, we see this all the time. It's outrageous,
Hmm.
right? Think about all the think about you going to the grocery store, right, and trying to buy eggs, but having the same money you had 10 years ago. Like I mean, good grief. It's not possible to operate. It's not possible to
Right.
survive. We're talking about survival here. We're talking about pillars of a community, organizations that are keeping a community alive and hopefully healthy.
Hmm.
Um, and so it gives them a lot of excitement. They know now where they can find increases. They start also thinking about, okay, where do we build out? We've got these really great rates here, or let's give over here. We're going to get an
Right.
increase in these services. Let's go build this out. We're going to be able to be profitable, and the community needs this, et cetera, et cetera. So it's just about kind of getting that compass on kind of where
Hmm.
you need to go, how it connects to your strategy, to your contract negotiation, to the relationship that you have with these payers, which goes well beyond just negotiated rates. It goes to, okay, how else are you dragging your feet on paying me? Okay,
Right.
you're changing the policy all the time, and there's overburdensome on the policy, which is also slowing down cash getting into our business. Okay, your denials are higher than everybody else's. I mean, this is one really important factor in a very kind of complicated relationship.
Okay. So whole host of things that are flurrying in my mind, but like no politics, no, just careful language here, just your lived experience. What is the real dynamic between payers and health systems today
Oof.
that most people like outside of the room would be surprised by?
It's untenable and unsustainable. It's worse than I
Mhm.
could have imagined. Um,
Like I knew it was rough,
I,
but I just wanted to confirm that. No,
yeah,
you
I
don't
think
need to name names or anything. Just
no, I think a lot of people kind of, especially, I mean, what I thought beforehand, like you think that the health systems or the providers, just anybody, and the insurance companies kind of work hand in hand. You think they would have to, I'm paying the insurance company and they're paying the provider when I need care and services. So you would think there is some, well, maybe a little bit of tension, um, but it's not a little bit. It's bad and it's breaking. It's breaking all across the country, and it's not always one directional in terms of who's, pushing on the other one, right? When you have network adequacy laws that require carriers to cover certain areas, um, the provider has more power than
Hmm.
the carrier in that regard. Most of the time, it's the other way, but it's something where, yeah, the relationship is untenable, and now you're seeing premiums that are starting to go up, and patients that are just not they're not going to get care because they can't afford
Yeah.
it.
Yeah.
So,
Foregone care.
and then we have the system where there's an uncertain number of people who are going to come to your business. It's not really a business. You're not selling things to people. It's just when they need your service, they have to come to you. Hopefully, nobody ever needs the service, and we would have to not have any care delivery organizations at all. But that's not how the world is. So you have this kind of like unpredictable business model. Um, and the hospitals and the care delivery organizations are just trying to map out how who they can keep on staff, how many people, how much
Yeah.
what equipment do they need? Can we invest in new technologies and new equipment? And we can't because we're not getting reimbursed enough, or our reimbursements are dragging for months and months, and we have
Mm.
no cash flow, and it's just an untenable. It has to be fixed
Yeah.
or
So
redone.
give me a specific example. You don't need to name names, but of a moment when like the data completely shifted the negotiation or like just rewrote that narrative in the room.
There's so many. Just looking at, I mean, just the easy thing to do is hospital, just looking at um, their inpatient rates, their DRGs, and just seeing how much lower they were than everybody else in a really concentrated and competitive area where it didn't make any sense for it to be that much lower.
Hmm.
And then being able to get serious increases. They were able to project out significant revenue because of that. There's kind of the great hospital stories of being able to get a fair shake, especially the smaller hospitals. Um, One that's really exciting to me though was there was a smaller practice. It was like a multi-specialty practice um, that no longer they were thinking about selling to private equity,
Okay.
and they hadn't renegotiated in a long time. And one of our customers helped them with the negotiation using our data and our platform. It was all just they just hadn't negotiated in a long time. It was just an easy win. Hey, here's your volume. You do this, you do that. You're way under the benchmark. We're going to go get these increases. They got them. They actually ended up not having to sell to PE, which like to me that's very exciting. An independent practice staying independent and
That's
focusing
right. That's
on
right.
delivering care like that is a huge win.
Hmm. Because I mean, look, you guys are in conversations with some of the best systems and top performing ones in the country. What do the top performing teams do differently aside from using your stuff when it comes to understanding their rates and like contract positioning?
They have really good teams. Like these managed care groups in these hospitals are some of the most impressive teams I've seen. Like I've worked in hospitals for a while. Like you kind of have the stereotypical idea of a hospital employee, which I think is, inaccurate and, definitely a stereotype, but you kind of have this maybe you're thinking of kind of the wrong kind of people. When you think of these managed care organizations, I mean, these are people who could have been lawyers. They have JDs. They are deep into contracts. They're working closely with the CFO. So for the ones that are performing well, they have a really strong team. Their team is very technology enabled and very comfortable with a lot of data. They're able to build out very custom analyses, and they're in the room with the CFO and the other leadership thinking about where do we expand, where do we build. And so it's very much where I see like the strategy from that C-suite really
Hmm.
being deeply ingrained into that team and kind of how they're managing not only kind of where we go, what new services we deliver, how we negotiate our contracts, but also really, I mean, they have to get into the weeds of these contracts. They have to get into
Hmm.
lawsuits. right? And the lawsuits of one particular hospital in an area will set precedent for how all of the other hospitals can either benefit from the outcome of that lawsuit
Right.
or be hurt by it. So it's really just about kind of, I think, number one, integration into the strategy. Number two, really, really strong teams with really strong, strong contract capabilities. And number three, very, very data proficient.
Mm. I'm curious, Jerry, when you think about, you're a technologist, you're trying to evolve, you're trying to innovate, make things better. What, like, if nothing changes, that's probably maybe your nightmare. I mean, what's the risk? What, um, what's the thing that nobody wants to say out loud if they are hesitant to change or just don't want to change about how they're going about this?
You know, the the risk is that the situation gets more untenable. The payers are charging more for premiums. We are seeing a lot through technology. We are seeing a lot more modern, like third-party administrators for employers. I think what will end up happening is the employers will start to get uh, they'll start to get involved, and
Mm.
more than they are today, right? They have a fiduciary responsibility to make sure that they're spending their funds appropriately. And this pricing data it's becoming abundantly clear that they are not. Not because
Right.
they knew about it, but because they didn't. They were trusting a third party
Third
to
party.
negotiate on their behalf.
Hmm.
And now you can see all the pricing, and we do a lot of work with them with employers and brokers and things like that. But they're able to see like, okay, well, my plan as compared to everybody else's plan is we don't get good rates um, at all. So, once your employees can start to see that again, like eventually all this stuff is going to be accessible and easy for people to see. You're going to start to see the lawsuits come in from the employees to the employers to say you're not being responsible with the funds of this company. You're
Wow.
violating ERISA laws. And then that's when people are going to start moving and and they're going to put pressure on the carriers, and the carriers are going to have to potentially negotiate better rates with the providers. The providers are going to have to do something because they're going to lose. They're going to start steering people away from those providers if they're not being reasonable on their rate
Mm.
negotiations, which is another reason you need to bring all the claims data in, and we're bringing quality data. There's
Right.
multiple different facets to this thing, but what you need to really what needs to what needs to happen is increase more transparency. We're going to have more. We need more
Yep.
laws, more accessibility from every aspect. Not even just uh, the commercial health plans, but
Right.
especially the pharmaceutical data. There is a whole treasure trove of information that is yet to be released there, and I know that that's a very sensitive topic for a lot of the PBMs out there and a lot of the big carriers. But at the end of the day, a lot of what the carriers do is now automatable by technology.
Yes.
We
Yeah.
have the ability to automatically process claims. We can use AI to do adjudication probably much more efficiently. I mean, some of these systems are 30, 40 years old
Yeah.
using. Um, Sometimes on purpose. Why upgrade the technology? This is just as slow as we want it to be.
Right. Right. Right.
Things like that. So uh, I think it's just a matter of time. I don't think it's a matter of if it doesn't change. It's just a matter of when and who
Yeah.
who needs to have the pressure put on them
Hmm.
to make a change.
I agree with Jerry
Mm.
100%. I would say our healthcare system right now, grossly oversimplifying it, is built on middlemen and secrets.
Yeah.
So we need to expose the secrets, and AI and technology can remove all of the middle layers. It's just you take a dollar and it moves through the healthcare system, and it's a game of slicing that dollar up into millions of pieces and people taking pieces of that dollar. We have to
Mm.
remove as much of that as possible, and we can now.
Amazing. Gonna switch gears a little bit here for a moment here. So, Jacob, I know that you like to roll. You're a Brazilian Jiu-Jitsu
Oh no,
guy.
you put that out there.
You belt. Anybody who's rolled, they know that it's controlled chaos. You're
Yeah.
solving problems when the space gets really tight. What from the mat has shown
Mhm.
up in your leadership style, especially maybe in moments where things get tense?
Thank you for that. Decisions under pressure, being able to stay calm, being able to breathe, and when you are feeling that pressure and your body is telling you panic, run, you're asphyxiating. To breathe, stay calm, and make those slow, methodical decisions using minimal energy and maximum technique. And I
Mm,
think, with a startup, you can really apply a lot of that. Besides, when things get really rough, I can always say nobody's trying to, strangle me right now, and so that kind of
right.
de-escalates how things feel.
Yeah. Yeah. I mean, listen, Brazilian Jiu-Jitsu humbles everyone. I think building a company does too.
Mm.
Um, I'm sort of curious, maybe what's maybe a moment that you can share that maybe your ego got checked in a way that actually made you like better.
Oof, so many. Um, this this whole journey has really been like thankfulness. Um, phew, you
I
know,
could say one for me
yeah,
that
yeah.
like
Go ahead,
Yeah.
Jerry.
I don't do Brazilian Jiu-Jitsu. Yeah, Jacob's trying to get me to, but
I've been trying to get
he's trying to get me to. Um, but actually,
Stick to
one of
cooking.
our yes, it's one of our first customers when when we were actually going through this process and we were trying to wield this like huge amount of data and as a technologist, I was really trying to understand what's possible. We have this 50 terabyte data set, trillions of rows of data, like what's going to be useful, and basically the answer was like we need to see everything, and that was something
Mm.
where I was like, I didn't even, I didn't think you were going to come back with that. I thought there was going to be some like small amount of this, but then like realizing that this healthcare world is so much bigger than I had ever thought it
Yeah.
would be, and that the smaller practices and all of these things, they all play a role into how a particular market actually functions. Like it's not just the big health systems
Yeah.
that are a part of the negotiation, right? You need to be able to look at everything in a market and understand the dynamics between them. And that was just for me. I was like, oh my gosh, I know nothing about this world. It was years ago at this point, but that was like a moment that I remembered just being like, wow, I don't know anything about this. And it's been repeatedly humbling, but
It
Yeah.
is.
Yeah. I feel like you're
but
getting humbled a lot.
yeah,
Yeah.
but growth, that's how you grow, I think. As long as you're willing to accept that you can be humbled and that you can learn something from basically everybody.
Yeah.
Yeah. I mentioned earlier in the opening that, you guys are going for the L word, like you want your customers to
Yeah.
really love you, and you've built trust with, health systems and practices and other groups that don't like easily just hand that out. Um, how do you like approach relationships, maybe in a world where things seem to be very, very transactional? Um, Curious about how you approach some of those partnerships.
It's radical honesty, a lot of education. This in the scope of healthcare and the healthcare timeline, this just showed up. This transparency concept just showed up. It's been around since 2022, but it's been a journey to get to the point where it's at now. And as Jerry said, we've got to make these huge hurdles with employers getting empowered. There's so many different people, there's so many different constituents, there's so many different stakeholders that need to be empowered. The patient, first of all, that needs to be in the center of all this. We've got the
Right.
employers that are funding a lot of this. We've got the plans. We've got the care delivery organizations, right? And everybody is trying. It needs to kind of figure this out.
Mhm.
So a lot of what we're doing at the beginning is asking and trying to understand, do you understand what this data is? Have you used it before? Like, where are you on this journey? And we start and meet them where they are and start there. I've told customers now that we're prospects, hey, don't buy this right now. And they were like, what? What do you, because I found out a market they were in where one of the carriers, it was one of the blues, was not being compliant in that market at the time. And we put our compliance scorecard on the internet, it's on the public, just to show like not only are you following the law, insurance carriers? Are you following the spirit of the law? Are you designing barriers to make this hard for people to get? Um, and so when they told us what they wanted to do, I said, hey, just wait. Let's do a POC. I'll let you know how things are going. I'll continue to
Yeah.
send you updates. Why don't you wait? They ended up reaching out soon thereafter and saying, no, we'll just go with you. And I said, I thought I told you to wait. I said, Why? And they told me we just feel like you'll help us more than everybody else. And that is, I guess, if you had to encapsulate what makes us different, is we do love our customers and we're going to help them as much as we
Mm,
physically and intellectually can.
mm. I know we're almost coming to time here. Before we do, just maybe give a moment. Where do people go to kind of follow the journey, follow you on socials or online, how they can just get a hold of you? So go that route.
Okay. Jerry, let me know if I forget anything here. Payerset.com, www.payerset, Payerset with an E, Payerset.com. We're also on the LinkedIn. I'm horrible at social media. I'm not on social media myself. So I know we're on LinkedIn and I know um, our website, you can get to us directly. If you do reach out to us through our website, we are going to see it. Jerry and I are
Okay.
going to see that along with the
Okay.
leadership team, and we would be happy to, talk to you about kind of current state where things are, policy where things are going. And Jerry's been involved in that and kind of being in the room talking about kind of how the updates um, to the CMS rules and the transparency rules are going to what they're going to look like, and we're really excited about where things are going.
Nice. All right. So I just want to maybe we'll kind of close with this. Just sort of maybe close your eyes for a moment and imagine every CFO, managed care leader, people in finance, operations, and in the country is actually listening right now.
Mhm.
What is the one thing you want to say to them? And maybe we start with Jerry and then maybe Jacob.
Yes, it is possible to see every price for every carrier, for every provider, and we can help you get all of those prices as well as help you understand how you can strategize your pricing your pricing policies and your pricing strategies. We can actually help you along with that journey. So that is here, and the best, in my opinion, way to get to deregulation at scale, which is what we really need,
Mm,
is through transparency. You can't when you deregulate without transparency, you get bad actors. Uh,
Mm,
so uh,
well said.
our push is for much more transparency, because that'll eventually lead to the ability to deregulate, which will take away the red tape and actually let the care delivery system that we have deliver care to patients. So that's what off my
awesome.
soapbox.
I can't beat that. You sure you want to go to me next?
Well, if you want to do a mic drop, that's fine. That's fine.
That's it.
Jerry just like, that was like a five-star Michelin course meal. So I think we're good.
There we go.
Um,
Agreed.
listen, Jerry, Jacob, like this is a lot of fun.
Yeah.
I think just from the first time that we chatted, I knew that we'd eventually have this conversation. And today confirmed why I thought it was going to be fun. I think you all just have a way of taking something that's really complicated and heavy, and you've made it clear, definable, approaching it in a very pragmatic, calming, and usable way. And even just the way you talk about pressure moments and Jacob, just on the mat being in the work, breathing. I think that says a lot about the leader that you are and what you're aspiring to do as a company. So for everyone listening, if you're listening to this, if you found this conversation to be useful, or if you walked away with one thing today, my hope is that it's that clarity isn't just data. It's how you make better decisions. It's how you build healthier relationships, whether they're with a payer, by using this information in a way that's coherent. And it's how you move your organization forward, admittedly, well, without losing your mind in all this damn noise that we've got out there. So
Hmm.
if this episode moved you in some way, shape, or form, share it with someone. If there's a topic that you want us to explore more of, or if there's a leader that you want to come onto the show, drop a note. We read them, look at the comments. Again, the platform that we are building here, it's not just content. Like, this is a interactive, living, breathing community and ecosystem. So thanks for listening. Keep building with purpose, and we'll see you next time on the Advancing Healthcare Innovation Show.
Thank you. Thanks for having us.
Thank you for
Yep.
having us.